Imagine walking into a room. Someone with measles was there 2 hours ago. They have already left, but the virus is still in the air. And if you are not immune, there are very high chance you could get infected. That is how contagious measles is. Many people think measles or rubella is simply a childhood rash, but in reality, measles is considered one of the most contagious viruses known in medicine. It is far more dangerous than most people think. Measles is a highly contagious airborne viral disease that can lead to severe complications such as pneumonia, brain inflammation, blindness, and even death. Even though we have a safe and effective vaccine, measles still caused about 95,000 deaths globally in 2024, mostly in unimmunized children under 5. Between 2000 and 2024, measles vaccinations averted nearly 59 million deaths, according to the World Health Organization. And in recent years, outbreaks has been increasing again in several parts of the world, which raises an important question. Why is a vaccine-preventable disease still causing outbreaks today? Hi Healthy Buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will talk about various health topics in a clear, evidence-based way. And today, we will talk about measles or rubella. Before we dive deeper, there's something surprising. If one person has measles and enters a room full of people who are not immune, up to 18 people can become infected. That level of contagiousness is rare in infectious diseases. For comparison, one patient with early strain of COVID-19 can infect up to 3 people, while with the most contagious strain, the Omicron, one patient can infect up to 10 others. Many other viruses spread much less easily. And what makes measles particularly concerning is that person can spread the virus even before the rash appears, when they may not realize they have the disease. This video is part 2 of my series on diseases prevented by the MMR vaccine, mumps, measles or rubella, and rubella or German measles. Let's start with what exactly measles is and how it spreads. For most on human history, measles was considered an almost unavoidable childhood illness. Before measles vaccines were available, large measles outbreaks occurred regularly around the world. During these outbreaks, thousands of children could become infected within a short period of time. Measles infected millions of people each year and led to many hospitalizations and deaths globally. Because of this impact, measles become one of the key targets of modern vaccination programs. Since the introduction of the MMR vaccine in 1971, measles cases and deaths have fallen dramatically worldwide, according to the World Health Organization. However, outbreaks can still occur when vaccination coverage drops. Morbidity and mortality rates in the developing countries are substantial because of underlying malnutrition and secondary infections. When assessing the patients, history of contact with suspected case may be absent because airborne spread is efficient and patients are contagious before they know they are sick. After being infected with measles virus, patients usually don't feel anything for the first 7 to 14 days while the virus is replicating in the body. After that, the measles typically begins with non-specific symptoms like high fever and lethargy, sneezing, runny nose, coughing, conjunctivitis, or red, watery eyes that may be accompanied with photophobia. About 2 to 3 days after the symptoms begin, there is a tiny sign inside the mouth that can help doctors diagnose measles before the characteristic rash even appears. It has been described in medical textbooks for more than a century, yet many people have never heard of it. It is called Koplik spots. These are tiny white spots that appear inside the mouth, usually on the inner lining of the cheeks. They may look like small grains of salt on a red background. Koplik spots typically appear 1 to 2 days before the characteristic measles rash, which make them very useful for early diagnosis. The sign was first described by an American pediatrician, Dr. Henry Koplik, in the late 19th century, and it remains one of the classic teaching points in pediatrics today. Not every patient will have clearly defined visible Koplik spots, but when they are present, they can strongly suggest measles even before the rest becomes obvious. That early recognition can be important because measles is highly contagious and early diagnosis helps reduce further spread. If you are looking at this photo, you will notice that these spots are very small and easy to miss, which is why doctors often examine the mouth carefully when measles is suspected. Soon after these early signs, the characteristic measles rash begin to appear when the respiratory symptoms are maximal, about 3 to 5 days after the first symptoms. It usually begins as flat red spots that appear on the face at the hairline, then spread down the body. Small raised bumps may also appear on top of the flat red spots. The spots may become joined together too. As it involves the extremities, it fades from the face and is completely gone within 6 days. Fine desquamation or peeling of the skin may occur. Fever peaks to more than 40 degrees Celsius or 104 degrees Fahrenheit when the rash appears and usually falls 2 to 3 days thereafter. There are many other diseases with similar symptoms like rubella, roseola, streptococcal scarlet fever, staphylococcal scarlet fever, etc. Doctors may run some lab tests to confirm the diagnosis. PCR testing of oropharyngeal secretion or urine is extremely sensitive and specific and can detect infection up to 5 days before any symptoms. Measles is one of the world's most contagious diseases, spread by coughing, sneezing, or simply by breathing the air that was breathed by someone with measles. The virus remains active and contagious in the air up to 2 hours. That is how one measles patient can infect up to 18 others. Like most viral diseases, measles is self-limiting in immunocompetent patients. Recovery generally occurs in 7 to 10 days after onset of symptoms, and supportive therapy is sufficient to make the patient comfortable and preventing complications. Drinking enough water and consuming a healthy, balanced diet are as important as a sufficient rest and isolation. All measles patients should receive 2 doses of vitamin A supplements given 24 hours apart to restore low vitamin A levels that occurs even in well-nourished children. This can help prevent eye damage and blindness and may also reduce the number of measles deaths. Most people with measles do recover, especially those with good supportive care. Sadly, not all patients have such a good outcome. Doctors take measles seriously because the virus can sometimes lead to serious complications, even death. Particularly in young children, pregnant women, people with weakened immune systems, and those with underlying malnutrition, especially those without enough vitamin A. According to the World Health Organization, complications occur in a minority of cases, but when they do happen, they can be significant. One of the most common complications of measles is a middle ear infection. This occurs roughly 1 in 10 children with measles and can cause ear pain, fever, and temporary hearing problems. Most cases recover well with appropriate medical care, but untreated infections can sometimes lead to a longer-term hearing issues. The complications that concern doctors the most is pneumonia, which is an infection of the lungs. Pneumonia is actually the most common cause of death associated with measles, especially in young children. This can happen because measles virus weakens the immune system, making it easier for other infections to develop in the lung. A much rarer but serious complication is encephalitis, which means inflammation of the brain. This occurs in about 1 in 2,000 measles cases. Encephalitis can cause symptoms such as severe headache, seizures, or changes in consciousness, and it requires urgent medical care. Some patients recover completely, but others may have long-term neurological problems. Other complications include hemorrhagic measles, the severe disease with multi-organ bleeding, fever, and brain involvement. The thrombocytopenia, appendicitis, keratitis or corneal inflammation, myocarditis or heart muscle inflammation, premature delivery, or stillbirth. Another interesting aspect of measles is sometimes called immune amnesia. Research suggests that measles infection can temporarily weaken the immune system's memory, making a person more vulnerable to other infections for months afterwards. Because measles spreads so easily, even a small percentage of complications can translate into a significant number of severe cases during outbreaks. That is why public health organizations like the World Health Organization emphasize prevention through vaccination. The encouraging news is that measles is one of the most preventable infection diseases in modern medicine. So, how do we prevent measles? The most effective protection comes from MMR vaccine. According to the World Health Organization, the measles vaccine is highly effective. After 2 doses, the vaccine provides about 97% protection against measles. This high level of protection is the reason why many countries have been able to dramatically reduce measles cases over the past several decades. Vaccination also helps protect people who cannot receive the vaccine themselves, such as infants who are too young or individuals with certain medical conditions. We call this herd immunity. Because human is the only reservoir for measles virus, it is a prime candidate for eradication, to be banished for good, forever, from the world. We eradicated smallpox before with global vaccination programs. So it is not impossible. It is very possible. Let's work together to eradicate measles too. That is my sharing today about measles. It is often remembered as a childhood illness from the past, but it remains one of the most contagious viral infections known in medicine. Understanding how it spreads, recognizing its symptoms, and knowing how it can be prevented are important steps in protecting both individuals and communities. If you found this video helpful, you may also want to watch the previous episode in this series where we discuss rubella, another disease prevented by the MMR vaccine. And in the next video, we will explore mumps, the third infection covered by the MMR vaccine. If you like this kind of health information, please like this video and subscribe to receive more information from me. If you have health questions or topics you want me to cover in a future video, kindly type in the comment. But please do not consult your personal health issues here, as it must be done personally with your doctor. This is my disclaimer. Thank you for watching and see you in the next video. Stay healthy and happy.